being a doctor is a worst patient.
The most unique foreign body you have encountered in?
సో తినేటప్పుడు మాట్లాడొద్దు అనేది సామెత. సమ్ విజిల్ వాజ్ దేర్ విచ్ ఐ స్వాలోడ్ as a thermometer, broken thermometer, one part is out, one part is inside. End of the day, initiation of ECMO in an indicated case, timely management with a proper team in a proper center will give a good outcome.
So welcome to the program, doctor, and it's such a pleasure to see you and meet you again.
Thank you.
So lungs anangane, we often talk about big issues, like pneumonia kanivandi or asthma or COPD or some blocks in the lungs. But did you ever think that, a small thing such as a peanut kani, a coin kani or a toy, it can be causing a life and death issue?
So it is a question of the hour, we can say, because main suspicious of foreign body will be more common in kids, like less than 10 years age. Everybody will suspect. There is a maneuver called Heimlich's maneuver. So తినేటప్పుడు మాట్లాడొద్దు అనేది సామెత. So that is true. Reason is whenever we are swallowing, fraction of seconds breathing will be stopped. That is called apnea. This is a natural process to prevent the aspiration. We have an interesting story, like 17 years boy suffering with a cough and fever, multiple antibiotics tried. And when I went for the outreach clinic at nearby, so there I pick up that particular pneumonia and treatment was started, not responding. I went for the further investigation like CT scan chest. Then CT scan showing some necrotizing granuloma and cavitating lesions, which is more commonly in India, it is tuberculosis. When I asked them retrospectively, so he recollected slowly and telling, some vigil was there which I swallowed. I thought it has to come digest. Or
He did not tell it to the doctor appudu varaku?
Yes. So it was a history of 4 years back. But major chunk of the foreign body was stuck into the right side of the lung, and that is obstructing the mucus extraction and it is causing the pneumonia. It wherein foreign body will give a pleasure to the treating doctor when it comes out easily, and even for the same thing holds good for the patient also.
What was the most unique foreign body you have encountered in?
Common is this one, hijab pin. That safety pin particularly they will use for the scarf to it, and they will keep that particular pin between teeth. Somebody is calling in a rush of maybe rush hour of bus, school and college, they will choke, aspirate. So same thing happens for the professionals like painters and all those things. They will hold those things within tooth. So that aspiration is one thing. As you said, very rare and unique is thermometer. I told foreign body as a thermometer, broken thermometer, one part is out, one part is inside.
In the lungs?
In the lungs. So when they kept a thermometer under tongue, just like for the routine evaluation of the temperature, because of the chills, he bite. So that makes the one was in, one was out. So that was major surgery postponed to the retriever of this one and then stabilized, and that was a different story. Second is this denture. Majority of dentures are elderly and they have Alzheimer's. They forgot some denture is there inside also. So that is one thing.
But don't you think dentures are big enough?
Big enough. Usually what they think, it was spill out.
Yeah, no.
So, but it was not so in one case or two cases. I have to retrieve, and it was simulating as a malignancy.
How about fish bones and chicken bones? Even that
recently fish bone, peanut and tamarind seed. Coins usually will go to food pipe when compared to the windpipe, and it will not give time. It will be acute, and majority will be kids.
So the bottom line is never to hold any object in your mouth and do something else.
Particularly, same instruction holds good even for the adults.
So what are some tips, especially manakanta time undadu, someone is choking. So what are some tips? First is to identify that it could be a choking or a foreign body inhalation.
Sudden onset cough. Cough is not months together, it is sudden onset cough, and some amount of missing objects nearby, and some loss of consciousness in an elderly age bedridden persons, and unable to hold the breath properly. Earlier they were the normal people, unlike every smoker or asthmatic. They are having these new symptoms, then to suspect.
So, what is the first step that we should be doing to save the person's life, doctor?
So first thing, you have to try with a Heimlich's maneuver if it is a kid like or less than adult age group.
I think this is one maneuver everyone should know.
Just like a CPR, Heimlich's maneuver, where you have to hold that particular center point of the chest, that is epigastrium here. You have to wrap down from the posterior backside of the person, and you have to just blow towards upper side so that it will come out. If not, rush to hospital, don't experiment anything, try to remove all those things are not a good idea. If it is visible, then fine. If not, better to go with the hospital admission and further management.
So sometimes, when the issue is small, you can clear it with a bronchoscopy. But sometimes when the issue is big and when the lungs are failing, that is when I think ECMO comes into the picture.
Yes.
Isn't it fascinating? ECMO is something which takes over heart and lung and does the job of heart and lung.
End of the day, initiation of ECMO in an indicated case, timely management with a proper team in a proper center will give a good outcome. Recently, we have a case of almost 42 years, 35 to 40 years middle-aged, morbidly obese person who stuck with a fire accident in one duplex house, and he was stuck with that smoke. And understanding the need of ECMO, understanding the gravity of the disease is much more important rather than doctors. Even same thing holds good the patient family. They have to afford, they have to understand, they have to agree and trust. Then only outcomes will be good like this. In this case, as a pulmonologist, we just observed serial bronchoscopies. Sometimes masterly observing in the serial bronchoscopy is also a more important, and in between we removed the plugs and we picked up the bug and we treated accordingly. So in this case, that is one satisfactory story of recent days from this unit. With the help of critical care, plastic surgeon, physician, and as a team, we saw that smile on the face of critically ill patient.
So what is one myth that you would like people to stop believing about lung health or ECMO, be it ECMO or foreign body?
So take home point in terms of these two, adult foreign body is not uncommon. So you have to be proactive history, you have to give to the treating doctor so that they will pick up early and treat early. Second, ECMO is not a rare and remote facility and foreign facility. It is readily available majority of the centers. Timely ECMO warrants the outcome rather than give up the situation. And pigeons, as I always stress upon this one, as a bird lovers, you can feed, but you cannot allow to inhale the pigeon droppings or pet droppings, because susceptible individuals are not in all. If family having a 10 members, only one will be develop that particular hypersensitive pneumonitis or ILD or allergic. These are the things which are progressive. If you stop the exposure also, disease will go and end up with the lung transplantation. And smoking also, I want to give one, e-cigarettes and vaping is not safe, and filter cigarettes, all these are equally bad.
So what are some healthy habits that you have inculcated in your lifestyle?
Being a doctor is a worst patient, majority will tell. So we have to perform our job with the proper breathing techniques like pranayama or whatever the breathing techniques, aerobic exercises. Some exercise whichever you like, stick with that, follow every day, and proper diet, and teetotaler will be good, and occasional these things, though I am not suggesting, and devoid of stress, at least in between your work hours.
Thank you for your wonderful insights, what you have shared with the viewers out there.
Thank you.